Hello and welcome. And thank you, Mr. Correa, for the opportunity to spend some time with you on Wellness Wednesday. My name is Jim Herkimer, and I got a quick little story. I had a patient not too long ago that called and tried to get seen. She was having some neck pain, some headaches. Sometimes that pain would radiate into her shoulder. She's got two kids, 16 and 18. One's getting ready for college. One's in high school. We've got issues with COVID. Things are home. Things are getting kind of heated in the household. And she came in to try to get a little bit of relief. But really, she told me, I'm feeling kind of overwhelmed. And I've got, my neck hurts, my head hurts, goes down into my shoulder. I can't sleep at night. So we're going to talk a little bit about this patient's problems. But at the same time, we're going to talk about how we can take some lifestyle factors and see if we can't make some adjustments to what she's doing or what you might be experienced with kind of life as we know it today. I'm here today with Kelly Berardini, and she works with me at Sports Conditioning and Rehabilitation. And so, Kelly, I'm going to turn this over to you. What's your first question?
I'm a wife, mother, and I have a job, and I love all of these things. However, I do get concerned regarding stress and how that is potentially affecting my health, especially in the long term. What are some of the things I can do now to have improved health and to just be more satisfied?
So, Kelly, you're feeling a little overwhelmed, a little stressed, huh? Well, the first thing I would say is that there are a number of different factors that really influence our perception of stress, and all stress is not necessarily bad. In fact, in the right dose at the right time, it's good for us. The problem is stress becomes bad when it becomes chronic. I want to take a step back and look at the nervous system for a second, and we have lots of divisions within our nervous system, but one division is called the autonomic nervous system, and that's split into two different sides: a sympathetic nervous system and a parasympathetic nervous system. And you can kind of think of that almost like the yin and yang of the nervous world. They're kind of constantly pulling in opposition to each other, and in a perfect world, they're always in balance. So the sympathetic nervous system responds to our response to a fight or flight. So you hear a loud noise behind you you're not ready for, or you're walking down a dark street in an unfamiliar neighborhood, and you have that elevated heart rate. You have those types of responses. That fluttering in your belly. Those are a response from your sympathetic nervous system to get you either ready to run or to confront. So they're getting your muscles and your organs ready to really to come to action. Okay, so after the threat is gone, the parasympathetic nervous system returns your function back to normal. So our parasympathetic nervous system decreases heart rate, relaxes muscles, allows for a full recovery. So we can really think of while trending in one direction is not ideal, balance is. We want to be able to run if a tiger is chasing us, sympathetic nervous system, and we want to be able to recover from that short, stressful situation. But where we get into problems is when that nervous system is bombarded all day long, and so now our sympathetic nervous system is working on overtime, and we never give it a chance to recover. Hans Selye developed the general adaptation syndrome theory back in the early 1900s, and it really illustrates this theory. It's really well illustrated in this diagram. So in stage 1, we have an alarm, which is an alarm is, again, alarm is okay. It's not a bad thing. It's a bad thing when it's there for too long. So when we encounter the stressor, our body reacts and with this, fight or flight response, and hormones like cortisol and adrenaline are released into our bloodstream, and it happens in milliseconds. So we are going to either run from the threat or we're going to meet it, okay? And our resources are now mobilized. Now, the resistance, stage 2, is sort of the resistance. And in the resistance, the parasympathetic nervous system returns the physiological functions back to normal. So our blood glucose levels remain high, cortisol and adrenaline continue to circulate at elevated levels. But on the outward appearance, you look okay. And then this exhaustion phase occurs when the stressor continues beyond the body's capacity and the organism has started to exhaust its resources. And so that's when you become susceptible to disease and to death. So over time, we end up depleting important hormones and important substrates that we use for normal function. And the organism that is you becomes exhausted, your immune system becomes overwhelmed, and you become more susceptible to disease, inflammation, and injury. So Kelly, I want to go back to your original questions. What can we do about it? And that's really what we're all here for. What can we do about it? We know when we're feeling stressed, but what can we do about getting through that stressful situation? So exercise. There has been multiple studies that exercise has been shown to be equally as effective as antidepressant medication in those diagnosed in depression. Isn't that crazy? We can use exercise as a drug that works just as good as an antidepressant. Now, in the Duke Smile studies, there was no significant difference between a group on an antidepressant and a group in a 3-day-a-week exercise program. At the end of 4 months, their depression scores were not significantly different. They had the same level of progress. The interesting thing, though, is in follow-up studies, more than a year down the road, when you look at the exercise group versus the pharmacology group, the exercise group maintained more effectively those better depression scores. So not only was it equally as effective in the short term, but more effective in the long term. But please, this is important, especially in today's world where things are literally coming off the rails. This was only one study, and I'm not here to tell you that you don't have to take your medications. If you're feeling despair, see a professional. Okay, don't just start to try to take care of things by yourself if you are having issues. So please, 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 take care of yourselves. Okay, the next thing that we can look at in terms of bringing your sympathetic nervous system and your parasympathetic nervous system back into balance is some focused diaphragmatic breathing. Now, when we look at how we breathe, depending on how deep that breath comes, we'll sort of stimulate different parts of the autonomic nervous system. If you've ever kind of noticed when you tend to get more stressed, stimulating the sympathetic nervous system, you tend to take shallow breaths and you tend to breathe up here through your shoulders. those shallow breaths will actually stimulate an additional sympathetic response. Getting nice deep breaths through your diaphragm will stimulate your parasympathetic nervous system and help to calm things down. So again, it comes back to balance. Are we getting adequate balance between the sympathetic nervous system and the parasympathetic nervous system? So I want to go through that real quickly. I want you to put one hand up here on your chest and one hand down here just below your ribs on your belly. And I want you to take a nice deep breath in. And I just want that bottom hand to move as you inhale. And then as you exhale, the bottom hand comes back in. But you'll notice that my top hand has not moved up at all. What you'll find is when you take that moderately deep breath in, if you're not getting a good diaphragm breath, you're going to end up raising your chest. So you're going to see that motion as opposed to a good diaphragm breath. So we want to get that breath coming all the way in. I like to tell people, I want you to imagine the breath is coming in your lungs and out through your hips. Lastly, simply spending 3 to 5 minutes with some mindfulness or meditation. 3 to 5 minutes of meditation has been shown to start to change your physiological response. It will stimulate an immune response in a positive direction, and it doesn't take 30 or 40 or 50 minutes of meditation. You can start with something as short as 3 to 4 to 5 minutes. That simple mindfulness focused on clearing your mind will help decrease the level of activity in your sympathetic nervous system. So there's three good options. We need to exercise, we need to breathe effectively, and we need to maintain some mindfulness and meditation. All right, Kelly, back to you.
Jim, sometimes when I wake up in the morning, I don't feel well rested. I still feel tired, and this can be very difficult to start my day that way. So what are some things I can do to help improve the quality of my sleep?
Sleep, yeah. Sleep is one of the most underrated and one of the most important aspects of wellness. And not all sleep is created equal. I can remember, when I was first getting into the clinical side of things, we thought sleep was a passive activity and that all your body systems just sort of shut down for the duration of while you were sleeping. However, now we know that there are some very specific mechanisms at play, and we sleep in cycles. And in a perfect world, we've got 5 different cycles that we go through in an 8-hour period of sleep. Each cycle is roughly 90 minutes long, and they are divided into areas of deep non-REM sleep and REM sleep. And REM is rapid eye movement. So I can have periods of time where I'm in deep non-REM sleep and then REM sleep. And those cycles will vary. So earlier on, I'm in deep sleep more than I'm in REM, and as I approach waking hours, I'm in REM sleep more than I'm in deep sleep. Researchers are not sure what exactly is the reason, although they think most likely it has to do with processing new and old information and kind of putting it in the right place. Now, there's another system, another activity that's taking place when you're sleeping. And I think this is an important. This is very important for longevity and for maintaining health through the years, and that's this concept of cleaning the cerebral spinal fluid. So we know that our lymphatic system is responsible for taking metabolic waste products and filtering through the kidneys and then ultimately excreting them. Our brain has what's called the GLIMP system. And the GLIMP system is responsible for taking dangerous proteins out of the cerebral spinal fluid and excreting them and processing them out of the nervous system. So I like to kind of use the analogy of kind of, like you're cleaning the house, and when you go to sleep, you start sweeping the floors and you start picking up after, the day's events, and the house can be messy, and you're going to clean and you're going to clean and you're going to clean. You've got all night long to clean everything up, and by the time morning hits, man, the house is spotless. But if you're not getting adequate sleep, if you're getting less than 7 hours of sleep, then you run out of time. You run out of time, to finish cleaning the house. And so now all of a sudden there's some dirt in the corners. Well, I'm not going to worry about the dirt in the corners because, who's going to see it? And then we only get 6 hours of sleep the next night. And there's a little bit more dirt in the corners. And then we have a little bit more dirt in some different corners. And over time, we start to have this buildup of dirt. Well, this is a buildup of these amyloid proteins that have been shown to be elevated in people with dementia. So a lack of sleep may be a big precursor to Alzheimer's and dementia. So what's the magic number? How much sleep do we need? Well, minimum of 7 hours. Anything less than 7 hours, in addition to lacking the ability to clean the house, we also start to get a chronic inflammation of the brain and spinal cord. So we start to see this increase in inflammation that is associated with a lack of sleep, and we end up with that feeling of discomfort. So what do we do? I know that was really what Kelly's question was what can I do to feel better? What happens? What does it mean when I wake up and don't feel rested? Or a lot of times I will hear the flip side is I can't sleep. I'm getting 2 hours of sleep or 3 hours of sleep. I sit there and I look at the ceiling. So one of, as we've already talked about, one of the biggest, the driving factors of your inability to sleep is stress. Decrease your stress by putting into practice the mindfulness, the meditation, the breathing exercises, and make that part of your evening shut down. The number 2 on the list is, and this will be hard for some of you, put your phone and your tablet away 90 minutes before you go to bed. And when I say put it away, I mean don't have it in your bedroom. Keep it in the kitchen. Number 3, no TV in the bedroom. That stimulates, that blue light and that noise stimulates your brain and keeps you from falling into that deep non-REM sleep. Number 4, and this is a tough one sometimes, if you or your partner are snoring, you need to address it. You need to address if you or your partner might have some sleep apnea issues. Check with your doctor about having a sleep study done. They've become easier and easier and easier to do, and they're vitally important. And sleep apnea is a huge precursor to heart disease, stroke. It is easy to treat, effective, but you got to do it. Number 5, start your bedtime routine to power down. So have a routine that you do same time, same sequence every night. It might start with your mindfulness, followed by some breathing, followed by some meditation, followed by starting to dim the lights. And then lastly, the ideal room temperature for effective sleep is 65 degrees. So try to keep your room temperature at 65 degrees. And those are the things that will help kind of establish a more appropriate and a little bit easier sleeping routine. So remember, sleep doesn't start when you go into bed. Sleep starts when you start getting ready. Okay, Kelly, what else you got for me?
Jim, tell us why exercise is so important We hear that we need to get 10,000 steps a day. There's a lot of different information out there. I want to be able to fit in the most effective types of exercise during my day because I have limited time.
So exercise is one of my favorite topics, but I think it's important to realize that we really tend to put a lot of emphasis on exercise. We say, exercise is going to cure everything, but we need to keep in mind that exercise is only one piece of the puzzle, and how we exercise is equally important as what we're doing, or the fact that we're doing something. So we can divide exercise into a couple. We can divide it in a lot of different ways, but for us, we're going to divide it into two areas. We're either cardiovascular or aerobic exercise, and exercises that improve your strength. They're important at different phases in your life. They're important all the time, but earlier on, so as young adults, cardiovascular and aerobic exercise tends to be a little bit more important because just the days, our daily activities tend to maintain a certain level of strength, and mixed with the appropriate levels of hormones, we tend to stay fairly strong. And then as we get older, our need for strength training actually increases significantly. So for those of us who are in our 50s and 60s and 70s and 80s, it's important that we really make the emphasis on incorporating strength exercises. And that's always sort of tough because I know a lot of folks, as they get a little bit older, they don't have any desire to do any strength training, and they certainly often avoid the big box health clubs. And what I want to get across today is that you don't need to have a health club to incorporate strength training into your program. But let's start with cardiovascular exercise, and there's a couple of I'm sort of a stat geek, so I want to show you guys a little bit about the importance of exercise and what it can do, and so we know that exercise has been shown to have a 14% decrease in the incidence of breast cancer and a 21% decrease in incidence of colon cancer, a 28% decrease in the incidence of diabetes, a 25% decrease in the incidence of ischemic heart disease, and a 26% decrease in the incidence of ischemic strokes. So we can see almost a 25% decrease in diseases that are associated with some of the leading causes of death in the United States. So with that, let's talk a little bit about what does cardiovascular aerobic exercise mean? What is it? And the best way I like to think of what we can categorize a cardiovascular or an aerobic exercise as is really something that is repetitive, uses large muscle mass. You can do it over a long period of time, and you can do it at an intensity that stimulates a training response. So playing canasta, probably not aerobic. Riding a bike, that's aerobic. So when we are looking at the guidelines for exercise, we can see that the minimum amount of exercise is about 150 minutes a week. Now we can go up to 300 minutes a week. Now that's obviously not in a day. We want to separate that over 3 to 5 days a week. So if we're doing moderately strenuous exercise for 150 minutes, that's 50 minutes 3 times a week. So that is walking briskly, that is cycling, rowing, swimming. These are the types of things that are considered to be part of our cardiovascular exercise program. And we can use a formula called the FIT formula, the frequency, intensity, time, and type. So type is, again, that cardiovascular piece. So is it continuous and rhythmical in nature? Is it strenuous enough to elicit a training response? Can you do it over a longer period of time? So again, walking, jogging, running, for those of you who are fit enough to run, cycling, rowing, stand-up paddleboarding, these are all things that are valuable in terms of the type of exercise for our exercise prescription. The amount of time, like I said, 150 minutes. So if you're only exercising 3 times a week, it needs to be for 50 minutes. If you are exercising 5 times a week, then you can drop that to 30 minutes. I would encourage most people to try to do more than just the minimum. Try to do more than 150 minutes. Intensity. So this is a challenge, and we have some great wearable devices that tell us what our intensity is in exercise, what our heart rate is. We can use heart rate as an indicator of our intensity of exercise, and typically we would want to be in the 70 to 85% of our heart rate range, or less accurately in terms of our maximum heart rate. And we can figure out what our maximum heart rate is by subtracting our age from 220 is our predicted max heart rate, and then multiplying that by 70%, and that gives us a training heart rate. For those of you who are sort of new to exercising, I actually like to use something called perceived exertion, or just the talk test. So if you can carry on a conversation like I am with you, you're probably not exercising hard enough. If you're exercising with broken sentences, that's a good level of intensity. If you feel that you are exercising at a level where you can't carry on a conversation at all, that's probably, for our cardiovascular stimulus, that's probably a little bit too high. Now, there's a couple of things to keep in mind when we're comparing rate of perceived exertion and percent of maximum heart rate, or looking at our heart rate as an indicator. There are medications that you might be on that will blunt your heart rate response. So even if you feel like you're not getting your heart rate up high enough, and you are in that high level of perceived exertion, use perceived exertion as your indicator for intensity. Again, we're going to talk about frequency, and frequency is at 3 to 5 times per week. So that's sort of the cardiovascular side, and the benefits of cardiovascular exercise are manyfold. I mean, we have changes in hormones, we have increased capillary density, the little vessels that provide oxygen to our working tissues, including your heart. We get increased capillarization in your heart with regular cardiovascular exercise. It's one of the reasons why it's so effective in controlling heart disease. We get increased number of red blood cells. So there are some really great benefits of cardiovascular exercise. Now, the other piece that I want to spend a few minutes talking about is strength training. And the guidelines talk a little bit about strength training in looking at least twice a week, 8 to 10 different exercises, 8 to 12 repetitions per exercise. When I'm looking at exercise, I'm looking at strength training. I want to make sure that I am incorporating a few things. So I want to make sure I'm using, kind of large muscle mass. Now, I alluded earlier that we don't need to be at a gym. We don't need to go to an expensive gym with big equipment to do strength training. It's intimidating. I don't like it, and I own a gym, and I don't like to go in and use big equipment. I like to use body weight. And if I want to add some resistance, I'll add some bands, or I'll add some bottles of water. So you can increase resistance by adding more water to a bucket or to a water bottle. So there's a lot of ways that we can incorporate resistance training. Body weight is one of, if not, in my opinion, one of the best. So with push-ups and body weight squats, those are the types of things that can enhance your strength development. In fact, there's a study this is geared towards men, not women, but in a group of men followed over the course, firefighters specifically, who were able to do 45 push-ups throughout their careers, had even as they got older, into their 50s and 60s and 70s, they could do 45 push-ups straight. They had a 97% decreased incidence of a cardiovascular event. That's amazing. A 97% decrease in incidence. So, there's a lot of factors to go into place, and I'm not going to say that if you can do 45 push-ups that you're not at risk for heart disease. There's a lot of other factors that go into it. But I think it's important that we look at the value of body weight exercises. Now, one of the other components I think is very important is that we add an element of balance. So that balance piece is critically important as we get older, because what is one of the biggest problems as we get older is falls. And if we can maintain our balance as we get older, our risk for falling will go down dramatically. So balance can be improved upon at any age. I can't stress that enough. It can be improved upon at any age. So incorporate balance exercises into your strength training. And an example would be doing a single leg squat. So you're balancing on one foot and you're squatting on that leg instead of squatting on two legs. That's a good example of some balance activities. The other component of this strength that I think is really important is developing midsection control. Some people like to call that core control, some like to call it core stabilization. I don't care what we call it. We just need to make sure that we're able to maintain good control through our midsection to protect our back and transfer forces from the ground through our hips, trunk, into our shoulders, and allow us to stay upright for a longer period of time. What happens to people as they age? They start to collapse forward. We need to maintain the strength to stay upright and keep our chest up high and keep our back strong. So that's the piece of the strength component that I can't stress enough in terms of how important strength, cardiovascular exercise is for maintaining health. Again, it's a piece of the puzzle, and it's extremely important. Okay, Kelly, what do you got now?
I see so many diets out there now. There's the Whole30, there is paleo and keto. How do I know what's really best for me?
Okay, Kelly, so you want to hear a little bit about nutrition. Well, I talk about a Pandora's box in the health and wellness world. It's very interesting when we look at the available data out, and it's varied. I'm going to leave it at that. It's varied. And the important thing is that probably the most important thing is there is not one size fits all when it comes to nutritional habits, when it comes to nutritional patterns. While the keto diet may be effective for one person, it may not work well or be effective for someone else. And it really kind of comes down to how your body processes these different substrates, both micronutrients and macronutrients. So I think it's really, really vital that you all understand that you need to understand what works best for you. And let me just start with one of the things that I do when I have somebody that comes in and they've got some chronic pain, and we're not quite sure where or why, and we have suspicions that it might be coming from something that they're eating or their dietary habits. Is I'll do an elimination diet, or I'll encourage them to do an elimination diet where they're taking out sugar and flour and gluten. Oftentimes they're taking out legumes and alcohol. So they're going to eliminate foods that we know tend to be triggers for inflammation. And it takes about 21 days for the inflammatory mediators to come down about half, come down about 50%. And after that, we can start to get an idea of what people have sensitivities to. And what's the difference between an allergy and a sensitivity? So an allergy is when somebody has an acute response to something. If someone has a peanut allergy, they have some peanut or the peanut butter, and they're going to have a reaction almost immediately. Somebody who has a sensitivity to something could take days or multiple hours, multiple days to develop some type of low-level response. And so it's hard to say that this response was equal to this food that you ate a day or two previously. And it tends to build over time. And that's why the elimination diets really tend to be the gold standard for determining what is the most effective method for determining sensitivities to foods. And we know that a large percentage of the population has some level of sensitivity to gluten at least in this country. So eliminating gluten for 30 days or 25 days or whatever time frame, the elimination diet that you choose to follow, you have that opportunity, sort of what I like to call clean the slate. We're going to clean the slate and then slowly reintroduce those foods that you have taken out, and you'll know pretty quickly if you have a sensitivity to it. So once we've cleaned the slate, now we have opportunities to look at a variety of other ancillary types of health or nutrition plans. I don't even want to call them diets, just nutrition plans. One is the Mediterranean diet. I think I highly encourage people to look at the Mediterranean diet. It's been well established to be to minimize risk for coronary artery disease, and it's a low inflammatory based diet. Some people need a diet that is, or a nutritional plan that tends to encourage energy levels and mitochondrial function. Again, it comes back to working with somebody that understands how to establish your specific needs, following some type of an elimination diet, and then we can slowly start to reintroduce an appropriate diet. There are certain things that we know are inflammatory. So this is where I get up on my soapbox. Sugar is about the most inflammatory thing that we can consume. If we look at inflammation, for example, and this is a great analogy. I love to tell this. Use this analogy is we should have a low level of inflammation in our body at all times, and so you kind of imagine that we're in a room, we're in the house in the middle of winter, and we have the fire on. It's this nice low level fire, and it's keeping the room nice and warm. That's sort of how our normal immune system should be working. We should have a little bit of inflammation, a little bit of, we should have some inflammatory mediators circulating around so that they're ready to plunge on the problem. The problem with sugar is it feeds inflammation. And so oftentimes what happens is people who are having a diet high in refined sugars is sort of like taking kerosene and throwing kerosene on the fire. So now instead of having just this nice little low-grade fire keeping the room warm, now the whole room's on fire, and then the house is burning down. So we have to look at what are the sources for sugar. And it's easy. Processed foods. So when we look at anything with processed foods or low fat, because when we start to take low fat out, fat out of a substance, out of a food, we typically is replaced with sugar. So it's important to look at what types of food are we eating. A standard American diet is high in processed food, low in fiber, and we need things that are low in processed food, or really no processed food, organic in nature, kind of farm to table. That's what we like to think about, farm to table, so that we are maximizing our nutrient density. So that's sort of where we want to end with nutrition, is clean the slate, work with somebody that you can determine what is the best program for you, and eliminate processed foods, eliminate sugar from your diet, and work from that foundation. Whole foods, lots of color, and that will maximize your nutrient consumption. That's what we're really looking for. All right, Kelly, I think we've got time for one more question.
Jim, thank you so much for this information. It's so helpful. I have one final question for you, and that would be, how do I connect the dots when we talk about healthy nutrition and restful sleep and getting enough exercise and decreasing stress? I'm actually kind of feeling stressed out just talking about all of these new things I need to do. So what is the best way to start and to connect all of these important pieces together?
So we want to kind of put all this together. Is how can we take these concepts and apply them? And looking at it from a connecting the dots, and I think this is really important. Health and wellness is a relationship, and it's an integration of your mind, your spirit, your body, and all of the things we spoke about today kind of puts those together. Any one of these by themselves will help your level of healthiness, but it's not the end all. You need to really look at, how can I maximize my spirit with meditation and breathing techniques? How can I relate that back to sleeping well and mindfulness? And where do I add the nutrition piece? And am I providing the communication pathways that I need, so that I am maximizing the balance between my sympathetic nervous system and my parasympathetic nervous system? So exercise has fingers in all of them, but exercise by itself with a bad diet will get you nothing more than a high cardiovascular unfit person. Or we can have people who are not exercising, and they can be skinny fat, right? People who have very low muscle tone, and so they're not big, but they have a poor ratio of their fat weight to their lean weight. So getting all of these together is really the key to maintaining that success. So I can't thank everybody enough for listening, and Kelly and I have certainly enjoyed the opportunity to put this down for you guys, and hopefully you'll get some useful information that you can take back today and start doing some things that will have a positive impact on your life and on your future and your health. Again, thank you so much.